Lisa, thanks. Pennsylvania nursing homes are struggling to bridge their budget gaps, resulting in lower quality care for senior citizens.
Tonight, our Pennsylvania State Capitol correspondent Kara Jeffers is joining us live to talk about how this issue, Kara, traces back to a state budget decision more than 20 years ago, and it's finally catching up with the industry. Good evening.
Good evening, Mike and Eva. For Pennsylvania nursing homes, around 64% of residents are relying on Medicaid, according to KFF. Now, with that, there's a set reimbursement rate that these nursing homes are supposed to get for those residents. However, Pennsylvania passed a law over 20 years ago that lets them pay underneath that rate, sometimes up to over 20%.
Since the pandemic, more than 30 long-term care facilities and nursing homes have been shut down in the state.
Nursing homes lost many residents during the height of COVID-19. Since then, they have navigated high costs from inflation and workforce shortages.
But our reimbursements stay the same.
The federal government sets a reimbursement rate for Medicaid residents in nursing homes. However, in 2006, Pennsylvania passed a law that lets the state pay less than the reimbursement rate.
It was 94%, went down to 87%. There were times in 2024 last year where it went down to 74%.
The Budget Adjustment Factor, BAF for short, changes the rate every quarter based on how much money is in the state's Medicaid budget.
We want to renovate. We want to hire staff. We have unions to negotiate for the next 3 years. How do I know what to negotiate if I have no idea what I'm going to be getting paid?
The financial shortfalls had a big impact on staffing. Many nurses and skilled workers are working for contracting agencies instead of being hired directly by a nursing home. This leads to higher costs for these facilities with lower quality care.
Agency employees are not so committed to your facility. They come for a shift or for 2 shifts and they're gone.
Representative Ryan Bizzarro has introduced a bill that would set a 90% minimum for how far the reimbursement rate could drop.
The cost of not addressing this now you can't put a price tag on what it'll do to our aging population in the future.
Gelly really reminding during our interview, Gelly was saying that this is the last stop for a lot of people. Either they literally don't know anybody else or your family can't take care of you. They don't have the time or the resources to do that. So these facilities are incredibly important. They are fighting for this money from a lot of other special interests this year in the Pennsylvania state budget. From Harrisburg, I'm Kara Jeffers, Erie News Now.